Good morning, ladies. So, let's finish up chapter 22. We in the PowerPoint for chapter 22, we left off on slide 23. Yes, which should be drug class angiotensin converting enzyme or ACE inhibitors. So, on this slide, the action. It inhibits angiotensin 1 converting enzyme ACE, disrupting the conversion of angiotensin 1 to angiotensin 2, which reduce blood pressure, preserve cardiac output, and increase renal flow. This use is a single therapy for stage 1 and 2 of hypertension and not as effective in African Americans unless combined with a diuretic. Common adverse effects is nausea, fatigue, headache, diarrhea, orthostatic hypotension. About 1/3 of patients get a cough. Please refer to table 22.5 for the drugs. And ladies, understanding the renin-angiotensin aldosterone system, RAAS, is critical to understanding the actions of most hypertensives. So hold that medication and contact the prescriber if the blood pressure, the systolic blood pressure, is less than 100 millimeters Hg. One of the more common ones you will see is lisinopril. Okay, I'm moving on to slide 24. Drug class, we're still continuing with the angiotensin converting enzyme ACE inhibitors. So serious side effects or serious adverse effects, angioedema, which is swelling of the face, the eyes, lips, and tongue. They may have difficulty breathing. Initial doses may cause hypotension with dizziness, tachycardia, fast heartbeat, and fainting, more likely with older adults. Neutropenia, hyperkalemia, nephrotoxicity. It may cause fetal harm. It may increase blood levels of digoxin and lithium. Didn't have any notes there. I'm going to skip over the question number 5, and I'm going to move on to slide number 26. Let me get it up on my screen here too. So the next drug class is angiotensin 2 blockers called ARBs. The action of these are they bind to angiotensin 2 receptor sites and block the vasoconstriction from binding to receptor sites in target organs. Uses: alone or in combination with other antihypertensives to reduce blood pressure. African Americans may not respond well to therapy with an ARB only. Common adverse effects is dyspepsia, cramps, diarrhea, headache, and orthostatic hypotension. For specific drugs, refer to table 22.6 in this chapter 22, chapter 22, refer to table 22.6. And a couple of the more common ones you may see is losartan, which is Cozar, or valsartan, which is Diavent. I'm going to move on to slide number 27. We're still on angiotensin 2 blockers, ARBs. Serious adverse effects are hyperkalemia, more common in patients with renal impairment or diabetes mellitus. Monitor the patient's potassium levels and discourage potassium or dietary supplements. These can also cause birth defects. And I put a little picture on that slide. Moving on to slide number 28. Okay, so this drug class is called direct renin inhibitors. Um, the action of these are they block the first steps in the AARS cascade, preventing release of aldosterone. Is used alone or in combination with other antihypertensives to reduce blood pressure. It's not as effective in African Americans or older adults. Common adverse effects is dyspepsia, cramps, diarrhea, headache, orthostatic hypotension. Serious side effects are altered fluid and electrolytes and birth defects. And if you go back, you'll kind of see that there's going to be some commonality between the adverse effects. So take note of that. This is reserved for patients who do not respond to ACE inhibitors or ARBs. Okay, slide number 29. These are the aldosterone receptor antagonists. One more common drug is probably going to be Inspira. They block the stimulation of aldosterone at the receptor sites, preventing sodium reabsorption. So if they're preventing sodium reabsorption, that means that the water is not following. Remember, wherever sodium is, water follows, and we want to get that extra water off. So it can be used alone or in combination with other antihypertensives to reduce blood pressure, and it can be used to treat heart failure. Common adverse effects is nausea, diarrhea, fatigue, headache, and orthostatic hypotension. And as you can see, a lot of these can bottom out that blood pressure. Serious adverse effects: hyperkalemia, hyperlipidemia, nephrotoxicity, hepatotoxicity, vaginal bleeding, and gynecomastia. One of the more common ones you'll see in this drug group is aldactone. Let me see if I can, or at the generic name is spironolactone, but aldactone is actually the medication. So refer to the drug chart in the book. Continue with that. Along with the vaginal serious side effects, vaginal bleeding, there could be numerous drug and food interactions with this med, and lower dose required for older adults, those with hepatic failure. Okay. I'm on slide number 31, the calcium channel blockers. The action of these, they inhibit the movement of calcium ions across the cell membranes. Is ideal for first or second line drug therapy for hypertension. It is effective in African American patients. Serious adverse effect is hypotension and syncope and edema. Some of the more common names you may hear with this particular medication is Norbas, Cardizem, Procardia. So refer or review the drug box table 22.7. That's table 22.7. This medication is also used for heart rhythm disturbances and angina. And again, it is effective for African Americans and elderly patients. Okay, we are now on slide number 32. These are the alpha-1 adrenergic blocking agents. They block postsynaptic alpha-1 adrenergic receptors to produce vasodilation, and decrease peripheral vascular resistance. It can be used alone or in combination with other antihypertensives to reduce blood pressure. Also to reduce mild to moderate urinary obstruction. Common adverse effects is drowsiness, headache, weakness, lethargy, dizziness, tachycardia, and fainting. Please refer to the drug table 22.8 for these meds. One of the more common ones you may see is prazosin or Minipress. Those are one and the same. Okay, we are on slide number 33. Okay, these are your central acting alpha 2 agents. They stimulate alpha adrenergic receptors in the brainstem, reducing sympathetic outflow from the CNS. It's considered adjunctive therapy, meaning in addition to used only in combination with other antihypertensives. Common adverse effects is drowsiness, dizziness, dry mouth, altered urine color, altered test results. Serious adverse effects is depression and rash. Refer to table 22.9 for these medications. Adverse effects such as dry mouth and dizziness are self-limiting, meaning it might be for only a little bit of a time. Urine will darken on exposure to air. This is not harmful. False positive urine glucose tests may occur. I'm going to say that one again. A false positive urine glucose test may occur. Rash occurs with the transdermal patch application of clonidine. So if they use the patch, one of the side effects or adverse of that is they may get a rash. And again, one of the most common ones you may see in this group is clonidine. Okay, so let's move on to slide number 34. Okay, so we're still on central acting alpha 2 agonists. Do not abruptly discontinue clonidine. Could cause rebound effect with increased blood pressure. So rebound effect is if you discontinue it quickly, the blood pressure may rebound and start to be sky high again. It could be nervousness, agitation, and restlessness. Withdrawal symptoms could appear within a few hours and become severe in 8 to 24 hours. Use adhesive overlay to keep the patch in place. So, I'm thinking a Tegaderm or something like that, but it may come with one, it may not. But there should be some kind of adhesive overlay to keep the patch from falling off or rubbing off. Okay, slide number 35. And this is the last slide for this chapter 22. This is the last slide. The last drug class here is direct vasodilators. So direct vasodilators relax the arterial smooth muscle, reducing peripheral vascular resistance. Is used in treatment of stage 2 hypertension, renal disease hypertension, toxemia of pregnancy. Common adverse effects are dizziness, numbness, tingling in the legs, orthostatic hypotension, palpitations, tachycardia, nasal congestion, hair growth. Serious adverse effects are fever, chills, joint and muscle pain, skin eruptions, and gynecomastia. One of the more common ones you may see in this group is apresilene or minoxidil. And another one is the nitroprusside sodium or NitroPress. And NitroPress is used in severe hypertensive crisis and refractory heart failure. And that is the conclusion of chapter 22. If you wrote notes or went through, make sure those are submitted by Saturday 1 o'clock. We are going to do a Q&A Tuesday after class for about 45 minutes to an hour. And that concludes chapter 22. And I am going to break these down per chapter so that the videos aren't overly long. That way you don't feel like you have to watch the whole thing and try to backtrack. So that's the end of chapter 22. And then I am going to go through chapter 24 on the next video. All right, ladies.